If you have acid reflux or you know somebody who does and has been living on antacids for months or for years, this video is for you, and please pass it along to those who you think could really benefit from this knowledge, which is, how do you know if you really have too little acid or you have too much? So it seems pretty intuitive. If you have heartburn, burning in your esophagus, it seems clear. There's too much acid, or at least that acid is in the wrong place, because it should be in the stomach. It should not be gurgling up or shooting up your esophagus. So it kind of seems like a no-brainer, too much acid, but not so fast. More often than not, it's actually too little acid. So what occurs is a variety of things. Number one is that your food, once you chew it, and you should chew it well, goes down the tube called your esophagus into your stomach, which is a nice bag of hydrochloric acid, at least it should be, and that acid is very efficient. It's a pH of 1 or 2. It's as acidic as you can get, and by design, that's exactly the way it should be, and it really breaks up that food very, very well into a nice little mush, and then that gets secreted out of your stomach into your small intestine, where new enzymes work on the food, and it's really that 20 some odd feet of small intestine where the bulk of digestion and absorption takes place. So, but the stomach has to set up that digestion for the small intestine, which is where a lot of, as I said, digestion and absorption takes place, because it's all about absorbing what we eat. Now, if you have insufficient acid, what happens is the food is just sitting in your stomach fermenting. Now, that fermenting can create gas. It's just sitting there in the stomach. Those gas bubbles can actually have a little acid attached to them, even though you don't have enough in the stomach in this scenario. Those gas bubbles are a little bit acid coated, and it doesn't take much acid in your esophagus to feel a burning. So that's one scenario. The other is that, again, due to insufficient acid, the food is not being broken down well enough. It's putrefying, and what occurs is that pressure builds up, and you can feel this if you're bloated, if you feel like you eat and it just sits there. That's exactly what's happening. And so it's sitting there fermenting, and that pressure is actually forcing open the valve that's at the top of your stomach. Your esophagus has a couple, as does your stomach. We're talking about the one in the stomach. It gets forced open due to that pressure, and up bubbles up a bit of acid that way. So there's a lot of different ways that we understand this can happen, but in all these scenarios I'm giving you, it's due to insufficient acid. You're not effectively and efficiently digesting your food because you don't have enough acid, and this scenario is happening, leading to bloating, feeling of reflux, heartburn, you have constipation, you have diarrhea, as I mentioned, bloating, abdominal pain. So all these symptoms that we also associate with, again, these symptoms of too much acid. And what happens to us? We're given a PPI, we're given acid reducing medication, whether over the counter or prescribed. They all result in the exact wrong action, which is reducing further the little acid that you have. I'm going to finish this video with a little test you can do, which is so easy so you can get a really good idea if you have enough acid or not. There's also a catch-22 of when you don't have enough acid, things proliferate and procreate. So not only is fermentation of food, but now you're this rich environment for things to grow. One of those things is H. pylori or Helicobacter pylori. This is a bacteria in your stomach that can lead to ulcers and gastritis long term. And so this low acid environment is what H. pylori loves. So you don't want to give it the environment it loves. You want to give it a nice high acidic environment to kill it. So again, and the really insidious thing about H. pylori is it tends to damage the very cells that produce acid, once again to make a happy home for itself, which is doing you no good. So low acid, not only happy environment for the H. pylori bacteria, it creates gastritis, inflammation of your stomach, and the other thing that it does is you're not absorbing and digesting your food very well. So protein digestion is compromised. Minerals like calcium, magnesium, and zinc are compromised. So you have a lot of it's going so wrong in your digestive tract because of this insufficient acid, which is being treated by making it more insufficient. So it's such a merry-go-round, and unfortunately this is the way people are treated. As soon as they say, wow, I have heartburn, I have some burning in my chest, and acid, off you go. So why don't we talk about how to test for this yourself? I did a video recently where I talked about taking betaine hydrochloric acid, which is actually taking betaine hydrochloride, which is actually taking some acid and seeing how you feel as you're eating a meal. But if you've ever had an ulcer and you're a little worried about taking more acid, like what if I have too much, these capsules they don't have a lot of what am I trying to say? The betaine hydrochloride is not like, drinking a bag of acid. It's very minimal, and what we have patients do is take one while they're eating a meal, and then the next meal, if they didn't feel any better, they increase it until they really notice a benefit. So, but if it's scary, if you're somebody who's had an ulcer before, totally fine. Here's a really great test you can do, which is baking soda. Now make sure it's fresh baking soda. It's not the box of baking soda that's been at the back of your refrigerator for 2 years. Get a nice fresh one, small little box, costs almost nothing, and you take a 1/4 teaspoon. This is first thing in the morning before you've done anything else. It's a 1/4 teaspoon in 4 ounces of water. So 1/2 cup of water, cold water, and drink it down. Then start looking at your watch and see how long it takes you to burp. So what happens is the baking soda mixes with the acid in your stomach and makes carbon dioxide, and so you burp. Now we want this burp to happen before 3 minutes, and the faster it happens, the better the acid content in your stomach. So if it's been 3+ minutes, especially after 5 minutes, then you can make a little self-diagnosis of insufficient acid based on the fact that it took you that long to burp. So this is really important to figure out because, again, too many patients are being treated as if they have too much acid, and there's really not so much a thing as too much acid. There is, if you follow my videos much, where I talk about the stomach is getting compressed and squished from a variety of reasons, and it's inappropriately shooting its acid up your esophagus. But then we have this side of the coin, which again is a malfunction of not enough acid still giving you those symptoms that feel like too much acid. So hopefully I've described that well enough. Please send me your questions, your comments. Share this video, please, with someone who's been on antacids for a while, because making this distinction is very, very important. Then when we know what we're dealing with, we can not only treat the symptom, meaning start giving you some acid, but also get to the root cause of why. Why are you not producing enough acid? And there's a variety of reasons, from infections to food sensitivities, and we can figure that out and really get the job done. I hope you found this video helpful. If you want more on this topic and others, click here.